The White House today, an invite to talk to the president for some left-leaning pundits and columnists and media folks. Talk to the president off the record, but we heard the general message from senior administration officials was we're going to fight back on Obamacare and continue the fight. We're back with our panel. We've been asking, well, yesterday we asked our panel, different panelists, about solutions, possible solutions here, because people are asking that all the time. What about this? How, if Obamacare, George, starts to implode, what are the solutions that either Republicans or anybody could come up with to replace it or move forward?
There's four simple things to do right away. First, and this gets howls, particularly from unions who negotiate these contracts, tax all employer-provided health care as what it manifestly is, compensation. But make people whole from that tax increase by allowing large tax credits to enable people to go into the market and shop for their own health care. Refundable tax credits for those who pay little or no taxes. Third, let them shop across state lines as we do for automobile insurance, and for no good reason we're forbidden to do regarding health insurance. Fourth, health savings accounts. My goodness, you buy high deductible insurance, you get tax-preferred savings, and you pay your own everyday health care expenses out of your own pocket. This gives Americans skin in the game. 50 years ago, the person receiving the health care paid 48 cents of every health care dollar. Today it's 12 cents. Americans need to have more skin in the game to become shoppers, to become price sensitive. We also know, finally, we have a lot of data now on high deductible insurance. We know, A, people with high deductible insurance use the health care system about 14% less than other people do, and B, they suffer no measurable decline in public health.
Amy?
Well, unlike George, I'm not a healthcare policy expert, and I don't think that people in the administration were either when they were putting this together. I think the way to get out of the hole is to delay it immediately for a year or more, during which time they obviously have to fix the way that people are going to purchase it, which is by fixing the website. And on the substance, they need to find a way to work with insurance companies to make more plans comply with Obamacare so that there's more choice and it's more appealing to consumers. They've found a way to make them so restrictive, to leave out so many key hospitals and physicians that no one's going to like what they find out once they get on the website. So they have to actually find a way to rework it at the substance level that they really didn't take at the time, and care, if you speak to people who are familiar with the negotiations on the front end.
Steve?
Don't rework it, end it. And once you end it, the centerpiece of any follow-on reform has to be what George mentioned, universal tax credits for the purchase of insurance. John Goodman at the National Center for Policy Analysis, who's known as the father of health savings account, came up with a plan in which he suggests tax credits for $2,500 per individual, $8,000 per family of four, which are the same what the CBO tells us Medicaid, new Medicaid enrollees will cost, and give people the option of buying on the private market or buying or jumping into Medicaid.
Well, you're talking there about upending the current system.
Right.
And it takes a big political lift to do that for the 80% who get their health care from employees, from their employers.
They will resist it tooth and nail because it's an inequity from which they benefit. The fact that they're getting a substantial portion of their compensation. Unions, the strongest unions, and this is the strongest reason for being in a union anymore, is because they can use their leverage to get you untaxed compensation worth, what Steve says, maybe $8,000. It's a great benefit, and the unions will resist this, but equity demands it.
There's kind of a broad point here.
Yeah, I think actually in an interesting way, Obamacare, if it indeed collapses and we sort of have to start over as a country, will have done Republicans a tremendous favor, because if you go back and look at Republican reform proposals over the years, they all include a basic assumption, and that is that the American healthcare consumer is an active one, not a passive one, and it's wrong. For years, we've had passive healthcare consumption. You might get a bump up in your copay and complain about it, or you might fight your insurance company on one or another charges, but you haven't been, most people haven't been paying attention to healthcare costs in the way that George points out. I think what Obamacare may do, if it collapses, people have been forced now to pay attention to these things. People, you don't have the luxury anymore of saying, yeah, I'm not interested, or I'm not going to pay attention, or I'm sure my employer is taking taking care of it. Now you have to pay attention to what you're getting, if for no other reason than to see what now might change or how costs might go up. This new active healthcare consumer, I think, makes fertile ground for Republicans to actually make those arguments now.
Just as an example of how people are now paying attention, I had lunch today with a doctor who also happens to be the senator from Wyoming, Mr. Barrasso. He said all over the country, doctors' offices are unusually busy right now because a lot of people are saying, that shoulder of mine, I better get that attended to while I still have insurance, maybe before the 1st of January.